A hearty good morning and welcome to the webinar. We are so pleased to welcome back our friend, colleague, and Social Security guru, Dennis Heywood of Social Security Solutions. And this will be over an hour, so upwards of 90 minutes. So sit back, relax, and be prepared to learn a lot about Social Security, Medicare, and more. But before we do that, just a few things I want to go through, a little bit of housekeeping. If you've got a question, please type it in the question box and we'll answer those questions really throughout the presentation. So don't hesitate to put a question in right away and I'll try to jump in. But we do need to keep things moving along here. I do want to point out, very important, that there's some handouts and you'll see them in the on-screen dialog box, under where it says polls and questions, and under that you should see a button for handouts. There's 4 handouts he's going to share with us. And again, questions in the question box. If you're having any issues with the handouts or with audio, etc., throw in the question box and I'll monitor that throughout the presentation. Here we are. I'm Jeff Beglin, lead account advisor with Cornerstone. I've been here for 17 years. We're the state's largest wholesaler for individual and group health insurance. Everything and anything you need in the realm of individual, my team can work with you on that. And I'm proud to introduce Brad Petrella. He's a new member to our team. He's the business development manager for Northern Ohio. And there's his information, and also Eric Pouncey, who's out today, but he's a great resource, and we're sort of the, we tag team things down here in Cincinnati in terms of all things individual. So don't forget to check out the Monday Minute newsletter and all that good stuff. Okay, let's talk about agency services. With Cornerstone's agency services program, you're the pilot of your business and we're your flight crew. And as a Cornerstone broker, you have access to expert services from our agency services program that can help you with your business outside your scope in planning for the future. We create a customized plan for you based on your specific needs to ensure that you, your business, and your family are covered. Contact us and we can tell you more about it. Autopilot, parachute, and flight plan, it's all there. So, let's talk about Denny. So before I pass it off to Denny, I want to chat a little bit about our friend. And he's been the president with Social Security and Medicare Solutions for the past, let's say, 19 years, Denny? And
yes.
In addition to that, he was on the Social Security department for 29 years. So he's got over 40 years of experience. So he is well versed in this and well suited for this topic today. And we're so thrilled to have him. So with the magic of technology, I'm going to toss things to Denny and he can take it away.
Okay. Thank you, Jeff.
You bet.
Cornerstone.
I think we've been doing this 5 years now.
Yeah, we've been doing it 5 years at least.
Okay. I can see your screen. So thrilled to have you. So thrilled to have you.
Good. I'm seeing you. Should I be seeing you? Should I minimize it?
I'm going to just kill my webcam and you can take it away.
Okay.
Thank you so much, Denny.
You're welcome, Jeff. Cornerstone. And I know there's a number of people listening and will be listening as I move along that have seen this before. And it's ever changing. I'll put it that way. But it doesn't change on the basic premises. Social Security has pretty much been the same since I started in 1973, except some of the concepts we're going to go over today have grown, and the litigation has allowed in a lot more people to draw on the benefits, which is one reason why they're concerned about the trust funds. But we'll get into that in a few minutes. It's good to be here. Jeff gave a good bio of me. I'm celebrating my 50th year doing Social Security work. I can't believe it, but it's true. Started in 1973. I live in Loveland, Ohio, which is just north of the city of Cincinnati. And for those of you that don't have my information, here it is on the screen with my website. Today, if you have questions today, I'm certain you can ask them here. I would appreciate if you made them just in general questions, clarifying the subject matter. If you've got other personal situations, specific situations you want to talk about, you can call me later. There's my phone number, because some of these other situations involve if, ors, ands, and buts that we don't want to go into today. So without further ado, here we go. Social Security. All right. Let's look at Social Security and Medicare taxes first. There's a form and a handout that I sent. Under the handouts, it says update at the top. I want you all to bring that up if you can. This is a nice little publication that Social Security puts out every year. You can usually get it in January of every year. And it talks about certain specific concepts, and talks about taxes and Medicare and supplemental security income. You're being taxed. They're taking money out of your pay, whether you know it or not, for Social Security. I'm just kidding, but these are the taxes for 2023. The basic tax amount is $160,200. So the first $160,200 is Social Security taxable. And this tax, 6.2% or 12.4% if you're self-employed, goes into the retirement and survivor trust funds. All right. There's an additional tax, Medicare, 1.45%, 2.9% for the self-employed on all earnings. Now, when we talk about earnings today, we're talking about W-2 wages or self-employment income, nothing else. So this is what's being taxed. There's a high income earners, 0.9% on all earnings above 200,000. You pay an additional 0.9% for a 250 for a couple if your earnings are over 200,000 for an individual. What I want to just cover for briefly is, and get this out of the way, is Social Security going broke? Yes. Will they do something about it? Yes, they always have. 1973, I sat down at a desk, and the first month or so, people were coming to me and saying, it won't be there when I retire, it won't be there when I retire. So I went to my boss and I said, what do I tell these people? He said, you tell them that as long as Congress has the power to tax, Social Security is going to be here in some form. And that's what I'm leaving with you today. So dispel that. It's been 50 years I've been hearing it. In 50 years, they've done things to fix the system. Some of them not so pleasant. 2016 was a big change year. And I believe what they'll do in the future is they will at least raise the retirement age, which means those of you who turn 62 now can start your benefit then. They'll probably raise that to 64 or 65. They may do away with the 8% if you wait until 70, but for sure they're going to raise that tax base from 160,000. It goes up every year. Last year it was 147,000. This year 160. And in years to come they'll do things. Now they may do it at 11:59 p.m. just before midnight on the day that they need to make the change, but they will make the changes. So there we go. Okay, now, a couple of concepts we want to look at. The update form that I had you bring up, we just discussed the top part of it. Update gives the changes between 2022 and 2023. If we were going to go down halfway on the front page, we're going to discuss two concepts together: full retirement age and earnings limits. Again, earnings defined as wages or self-employment. Social Security, for some reason, they never change this, and I know why, but they've never changed this. You got to prove you're retired if you want to draw your benefit prior to your full retirement age. At full retirement age, they don't care. That's why these earnings limits are in there. And if you look at the earnings limits under that, the right-hand column, if you're under your full retirement age, your earnings limit is $21,240. If you go over that, they withhold $1 in benefits for every $2 you go over that limit. So quite literally, that's why somebody making $80,000, $100,000, $150,000 a year can't file. They won't get anything. Now we get into people who were making $150,000 a year, they retire and make nothing at age, let's say 64, they could take their benefit at a reduction because their earnings are under the limit. There's a special rule for the first year of retirement. Let me give you an example. An individual leaves a company, and June 30th is their last day of work. And up to that point, they had made $100,000. They're making about $200,000 a year. So up till June 30th, they made $100,000. There's a special rule for the first year of retirement. They can take their benefit as of July if they keep their monthly earnings limit, their monthly earnings under $1,770 each month. So it doesn't mean they can't earn something from a job or self-employment, but they got to keep it under $1,770. That's in the first year people retire. So this 64-year-old person that left work at age 64, June the 30th was their last day of work. They're over the limit for the year, $100,000 they made January to June, but Social Security gives them a break and says, you can take your benefit, of course, at a reduction, and we'll pay you for July through December of that year with no offset. Every year after that, when they're 65, they come under just the 21,000 limit or whatever it is in that year. They can't make over that until their full retirement age. Now, in the year of their full retirement age, people can make $56,520 this year. If you look on the handout, for people in their full retirement year, they're allowed to make $56,520. This limit applies to earnings for months prior to full retirement month. So if their full retirement month was June of 23, Social Security is only looking at what they're making January through May. I got a really good example of that coming up on the Excel sheet. Full retirement age. Your full retirement age, if you were born between 43 and 54, is age 60, is the month, year you turn 66. If you're born in 55, it's 66 plus 2 months. So it's the month you turn 66. Let's say you turn 66 in March of 2021. Okay. April and May plus 2 months is your full retirement month, May of 2021. So you turn 66 in March, your full retirement month is May. And you can take the money and run after that, doesn't matter what you make. And you can see as you go down the list here, there are, 1957, 66 plus 6 months. If you're born after 1960 or later, your full retirement month is age 67. Now, if you earn over that amount in that month, in that period of time, they withhold $1 in benefits for every $3 you're over the limit. We're going to get into a specific example of this filing in your full retirement year, January of your full retirement year, in just a minute. I will tell you, note to self, this is where people leave considerable amount of money, in my opinion, on the table unknowingly. Let's talk about the eligibility factors. We've laid the foundation for the concepts. If you're taking it prior to your full retirement month, you're subject to an earnings test. You take it after, they're not looking at your earnings anymore at all. There's no limitations. You can take it whenever you want. Eligibility factors for retirement benefit. And this is a retirement benefit, not a widow or benefit or widower benefit. You must be at least age 62. You need 40 quarters of coverage. That's about 10 years work under Social Security. The earnings limits apply, so you can't be making $250,000 a year and draw your benefit at 62. And you got to file an application. And two ways to do that, online or by appointment, which we'll discuss in a few minutes. Retirement filing options. What I'd like you to do, I'll give you a second to pull up the Excel sheet. It's one of the handouts. It says at the top, filing January of your full retirement year. And I'll give you a minute or so to find that, because it's important that you understand this. Your filing options are to take it at 62, and you'll take, depending on what year you were born, you might take a 25 to it, and now it's around a 30% reduction in your benefit if you took it at 62. You can take it January of your full retirement year. This is what people don't understand. I'm going to wait till my full retirement month. I don't care. I want my full benefit. Okay, I get it. But let's look at the Excel sheet. This individual was born in March of 57. So there's 66 and 6 months is their full retirement month. So they turned 66 in March of 23, and their full retirement month is September of 23. They choose to take their benefit January of 23 at a reduction. I'm at the top of the Excel sheet. They're taking about a 4.5%, $162 reduction. Their benefit is going to be $34.65 a month starting January of 23. They could wait until September and take $36.27. But if they file now and take the $34.65, they're going to draw some benefits. So let's look under 2023 earnings. They're making $100,000 a year. All right. Wages prior to September of 23 is $66,667. Now, here's what people miss. Social Security is only counting their earnings January through August. So you divide that 100,000 by 12 times 8, and they're only making $66,667. The earnings limit for somebody in their full retirement year is $56,520. So they're only over the limit by $10,147. So Social Security, this person's filing says, okay, we're going to knock out the offset to $3,382, because that $10,000 is divided by 3, and that gives you the offset amount. So January 23 in the lower block through August, they draw $34.65 a month for 8 months. They could put $27,720 in their pocket. Social Security is going to withhold $33.82. Okay, that was their excess earnings. And they're going to put $24,338 in their pocket between January and August. I will tell you the logistics on this is you want to file, if you know you're going to do this, as soon as you can after August 31st of the previous year. So this person could have filed an application September 1st, telling September 1st of 22, telling this Social Security they want to start their benefit with January of 23. People leave a lot of money on the table here, and I'm all about putting as much of what you put into the system in your pocket as possible. So you're going to draw the $24,338. What Social Security will do is they will withhold your first month's check. Now they're only going to they only should withhold $33.82, but they're going to withhold the whole check and start paying you with February of 23. And when you file your tax return and your income tax return shows you did make 100,000, and this is the right, you'll get the difference back, the $100 between 34.65 and 33.82 for the month of January. So you draw this money until you turn 66 and continuing, which means you're putting about 24,000 in your pocket between January and your full retirement month, and your benefit stays at 34.65 until your full retirement month. If you look at the very bottom of the Excel sheet, they adjust the reduction September of 23 because you didn't draw a check in January. They kept your money. Anytime they do that, they give back a double negative. They give back the reduction month. So you're not being reduced for 8 months, you're being reduced for 7 months, and they make this adjustment when you reach full retirement age, and that 34.65 goes up to 34.85. $20, I know, not big a deal. However, many people are adjusted, take their benefit at 64 and have adjustments made, and these adjustments apply to everybody at full retirement age. And some people don't draw checks for 3 or 4 months or 5 months out of the year, and then for the rest of the year, and that benefit's adjusted when they turn their full retirement age. So that $162 is not a permanent reduction if they didn't pay you in some of the months for which you're filing. I know it's confusing, but this is how Social Security works.
Okay.
And what you would do when you go in to file, you would tell them, they ask how much you're going to make this year, and you would tell them 67,000. You're not quitting work, all right? You're working right through 2023, right to the end of 23 and continuing, making 100 grand. But you tell Social Security, I'm only going to make 67, charge that to me because I'm full retirement age in September. This second bullet here, January, the full retirement year, a lot of people miss out on. I don't advise people, you need to do this, but I tell them this is there for you to do, you need to think about it. So if you don't want your benefit in January, your full retirement year, you can wait till your full retirement month. That's the third bullet on the screen. There's no reduction. And this person in the Excel sheet would draw the 3627. Look at the break-even age here. At the bottom of the Excel sheet, it's going to take you 15, almost 16 years to get that 24,000 back at the extra 162 a month if you wait until September to file instead of filing in January. So normally a lot of Social Security reps do give advice sometimes. Used to when I worked there, they don't anymore. But this is something that's very, are you going to miss that $162 at 82? I don't know about that. Might be the cost of a tank of gas, who knows? But there are, fourth bullet, you're eligible for delayed retirement credits. I personally am not a big fan of this. But in some financial planning circles, this is the thing to do, depending on your portfolio and your health. You're going to wait till 70. I mean, for some people, things start falling apart at 60, but for sure, a couple things are going to fall apart by 70. And so you're taking a risk here, waiting till 70, between 3.5, 4 years from your full retirement age, to get 8% on your money. Most people waiting that long now, it's going to be like an extra 900 to 1,000 a month at age 70. And that is a good option too for people who have great portfolios and want the maximum for their wife or husband when they pass. There's a restricting strategy. It's pretty much gone out the window. You can restrict your application if you were born prior to 1954. So anybody born in 1954 later cannot employ this strategy, and I'll discuss that in a few minutes.
These are your options. Denny, do you have time for a couple questions?
Sure.
Okay. Sorry to jump in like this. Just want to cover some early questions. So circling back to the credits. So anybody 65 or 65 plus having 40 credit hours living outside of the USA, one, can they apply for Social Security benefit, or do they have to enroll in Part B? I think they're also talking about Medicare.
Yes. Well, if they're living outside the United States, they can't use their Medicare.
Yeah.
We all know that. But if they're insured, they can file. I just had a guy a couple of weeks ago. He's living in Germany. He's going to file, take his benefit, and he's going to live in Germany. But he was over here, and he worked for a company under Social Security covers for like 12, 15 years. The Medicare becomes dormant if you move out of the country. Now, there are certain countries they won't send your check to. Iraq, Russia, China. So there are places where they won't send your Social Security check. And I'd have to specifically find out what country that they're in. But you can file and take your benefit. You can file while you're over in that country. Go online and file your application, and they'll process it and pay you. Does that answer the question, Jeff?
Yeah, if that wasn't at the end of the presentation, you can rephrase that question and we can go into that. But another important question, what qualifies as earnings? Does a pension count as earnings? We're talking about earnings.
Not for Social Security payment purposes.
Okay.
Depends what you mean by a pension.
Well, okay. Like an early teacher's pension, early retiree, something like that. Like you retire when you're 55.
It does not count as taxable earnings for Social Security purposes. But if you're taking a teacher's pension and didn't pay into Social Security, you're going to get hit with the government pension offset and the windfall elimination, which I'm going to cover in a few minutes.
Perfect. Okay, great. That's a good lead in. Thank you.
Okay.
That's it.
Anytime, just cut in. These are your retirement filing options. All right. Now, auxiliary benefits. Who can get money on your record? These people listed here can file on your record. Auxiliary benefits, and I'm talking about you're getting a retirement benefit, and these people are eligible for money on your record. Your spouse or divorced spouse age 62 and married for at least 10 years. Your spouse only needs to be married to you for a year to draw as a spouse. Divorced spouse needs a 10-year marriage requirement. The divorced spouse can file on your record, even if you haven't filed, as long as you were married for 10 years and you've been divorced for 2 years. That's called an independently entitled divorced spouse. So it used to be that, let's say, Husband and wife get divorced. Husband goes on and says, I'm not going to file for my Social Security because she'll get some of it. Well, that's out the window now, because even if he doesn't file, she can file on his record if they've been married for 10 years and divorced for 2 years. But back to the bullet there, spouses or divorced spouse age 62. Okay, so this is someone who has reached their own retirement age. However, as you'll see in a few minutes, what they can get on their own record is going to offset any spousal benefit they can get. A spouse or divorced spouse any age, if they have a child under 16 in his or her care. So if you're divorced and your wife has the children and she's got a 14-year-old and a 15-year-old, the spouse can get money if the child's in her care. Not only that, but the children can get money on your record if the children are in her care. Unmarried children through age 18 or 19 if they're in school. So you file for retirement, you've got a 15, 16-year-old in high school, they can draw money on your record until they graduate, or 19 if they're still in school. Disabled children, fourth bullet down. If they were disabled prior to age 22 and have not engaged in substantial gainful activity, which is about, let me look here, $14.70 a month earnings from a job. So children disabled prior to age 22 are potentially eligible on your record and will be forever. The benefit is 1/2 of the wage earner's full retirement age benefit, subject to the family maximum, and earnings limits apply to the above beneficiaries. So we got a couple things coming into play here. You've got a spouse, an ex-spouse with children in her care, but she's out there making 70, 80,000 a year. Well, she can't get that. You've got an ex-spouse, he's out there making 70, 80,000 a year. I mean, he can't get anything on his wife's record or his ex-wife's record. So all these persons here that can receive on your account, they're subject to earnings limits. Now, usually the children aren't affected, but adults, the divorced spouse might be. The family maximum is about right now for someone who paid maximum into the Social Security system. They're going to be drawing about $36.27 a month this year. If they paid maximum into Social Security for the past 35 years, they draw about $36.27. And the family maximum is about $5,600, which means they don't, if you got a wife and 3 children, they're all not going to get 1/2 of that $3,600. They'll divide the difference between the maximum $5,600 and the $3,600 between the 2 or 3 of them, just to be clear. Spousal benefit calculation. First of all, there's a lot of misunderstanding about spousal benefits. When I say spousal and when Social Security says spousal, that's the wage earner's alive right now. All right. Widow benefits is if the wage earner dies. Okay. Some people get that spousal mixed up. And I hear a lot of this myth, well, my wife can get half of mine. Well, yeah, she can, except let's read on here. If she's got a benefit, she's not going to get exactly half of yours. So let's say the high wage earner at full retirement age can get $3,400. The low wage earner, the spouse, at their full retirement age could get $1,700 on that account, half of that $3,400. Okay. If they never worked, they could draw that $1,700 at full retirement age, or when the high wage earner files and they're just 63, they could take that $1,700, but it'd be reduced. because they're taking it early. However, the low wage earner in this case can get $1,000 on their own record at full retirement age. So Social Security subtracts their full retirement age benefit, $1,000, from what they could get as a spouse and comes up with $700. That's their full retirement age benefit for the spouse. They're only payable when the higher wage earner starts receiving benefits, unless the couple's divorced. Then the divorced spouse can file if they're 62 on that record. Then the wage earner doesn't have to have filed. So you can see where someone says, most of the cases I run into, okay, this is about half of them are going to wait. They talk about waiting till 70 to draw benefits. And until we sit down and they go over, I say, I had one exactly like this a couple of weeks ago. You realize that your wife, when at age 66, your wife can draw an extra $700 on your record as a spouse while you're waiting till 70, and you're leaving $175,000 on the table until you're 70. That changes the perspective a little bit on when to file. This is the spousal benefit calculation. I just wanted everybody to hope it's clear that half of the wage earners less your own is not half of my wife's going to get half of mine, does not apply literally, okay, but wife could. Let's talk about voluntary suspensions. You can suspend your benefit between full retirement age and age 70. Previously, prior to 2016, if you suspended your benefit, your wife or husband could get half of it through their age 70. It was a good deal. It was a great strategy. But if you suspend now, no one can receive on a suspended record except divorced spouses. They can receive on a suspended record. Just in case the ex was going to say, I'm going to file but suspended, and my ex-wife can't get anything. That's not true. Other than that, no one can receive a benefit on a suspended record. Plus, once you suspend, third bullet down, there's no retroactive right to a benefit, and it eliminates the 6-month retro possibility. Let me explain that. Let's say you haven't done a thing, you got Medicare, but you were still working, and you reach age, let's say 68, all right? And you decide, I want to file, take my benefit at 68. Well, you got a choice then. You can go back 6 months or back to your full retirement age benefit, whichever month, whichever comes first. Because you haven't done anything. You're just sitting there waiting and decided 68 to take a higher benefit, not going to wait till 70. Well, you take this benefit and you can go back 6 months if you want to. Maybe draw an extra, $30,000 going back. If you suspend, you can't go back those 6 months. Once you suspend and you want to start your benefit, Social Security will say, okay, we're starting it next month. It used to be, prior to 2017 or 16, if you suspended at age 69 and 5 months, you could go back to your age 66 and draw your benefit at a lower rate without the delayed retirement credits, but you could go back all the way back. People used to go back and draw, 35, 45,000 going back. You can't do that anymore if you've suspended. The only retroactive right is to go back 6 months or back to your full retirement month. So suspension, however, there is a strategy with suspension. The fourth bullet down, there's a possibility of suspending between full retirement age and age 70, even if the retirement benefit was taken early at a reduced rate. So this fits for some people who got a good portfolio, let's say, and this is the financial planning end of this, and I don't get into that, but I can see, and you can see how someone, if they took it at 62, took a 30% reduction, a 25% reduction, let's say they could have gotten 2,000 at 60 at their full retirement age, but they took it at 62 and they're getting 1,500 a month. They reached full retirement age, they can suspend that benefit, the 1,500. And the 1,500 will get 8% a month, a year through their age 70. So, and they may not need the money. I've had this happen numerous times when they come and say, hey, now keep in mind, once you suspend now, you can't go back. It's only a future month you can kick it back in at. This is voluntary suspension. So there is one other situation where this kind of works. It works to the advantage of the couple. If they have a disabled child, they could file and suspend, and that child files as a disabled child on that record. And 24 months later, the child gets disability, even though the child's not getting any Social Security monetary monthly benefit, and neither is the wage earner. 24 months later, that child's entitled to Medicare. So that's one area where if someone they're working full time and they don't want to file for their benefit, they could suspend it and have this disabled child receive Medicare on their record within 2 years. Always a possibility.
Good. Time for a couple questions.
Sure.
Okay, great. So question is, when you're self-employed, are you better off limiting your Social Security income at age 70, reporting $160,000 versus $80,000? What would your Social Security benefit be for the next year?
Well, that's hard to say. Read that again, Jeff.
Okay, you're self-employed.
Yeah.
And at age 70, you're reporting 160K, okay, versus 80,000.
Okay,
What would your increase? What would that increase your Social Security benefit for the next year? So, let's say you increased your income.
Well, if the question is phrased that up till age 70, okay, they paid maximum, and at age 70 they're paying on 160,000, and after that they changed lower it to 80,000 they're paying on.
Yeah.
They're going to affect their benefit. They're still going to get delayed retirement credits up till age 70, okay, but if they can maneuver to pay less into Social Security, pay 80,000, they are affecting future benefits, but not a whole bunch. I would say, I think what the person's asking is, how's that affect the benefit I'm going to draw at 70 if I reduce my earnings to 80,000 a year?
Yeah.
And I can put it in simple terms. You're probably going to get about $10, $15 less a month because you're only putting 80,000 into the system instead of maximum.
Okay.
Because each year with the maximum, it's hard to gauge because each year the maximum goes up. But when I do these calculations, it amounts to a really minuscule amount of money once you reach 70 and even before. So you're not hurting yourself.
Okay.
Okay.
Okay. Absolutely. Okay. And next question. If the higher wage earner passes away, I think we're getting into that spousal benefit we were talking about earlier. If the higher wage earner passes away and the spouse started taking her own retirement benefits at age 62, is it correct that she will not get 100% of her spousal benefit since she started her own benefit early?
That is true. There's a special computation, okay, for someone who has elected reduced retirement benefits on their own record, and then the higher wage earner dies, okay, there's a special computation. She just doesn't get the difference. It's like, it's less, but it's not horribly less. Okay, they do a three-tiered combination. It's called a rib limb case, retirement insurance benefit limited their ability to draw the full widow benefit. Yes, they will be affected. How much depends on the benefit amounts. I couldn't tell you right now. Sometimes it's that person is going to get $200 or $300 less than they would have if they hadn't filed early. That's usually the case.
That's a great question. Thanks, guys. Yeah, we're done for now. Thanks.
Okay. Okay, we're going to get into the windfall elimination provision. For those of you who have worked outside the Social Security system for any amount of time and can, well, not for any amount of time, but and are eligible for a pension, or while you may not draw a pension, if you've worked outside the system and have a lump sum somewhere, you're still going to get hit with the windfall elimination provision. So some people have chosen to, and let's say OPERS, the state of Ohio, okay? People pay into that, police, fire, they pay into it in the police fund, and they don't draw, they will draw a pension. State teachers will draw a pension on their record. But there are options for people out there, and I'm not all familiar with them, but where they can just contribute to a fund and let it gain interest, like a 401k, but it's not a 401k. It's where they're putting their money, like into a fidelity fund that would have gone into the retirement fund with OPERS, and they're putting it in a retirement fund with Fidelity or some other investment company. You're still affected by the WEP, okay? This affects pensions based on non-covered employment, like city, county, state, federal, or foreign country. The windfall elimination, the maximum offset is about $500 right now. So if you could draw 700, but you're drawing 700 social, if you could draw $1,200 a month Social Security benefit right now, but you're getting a pension from state teachers, and that pension, let's say, is $4,000 a month. Your Social Security, your $1,200 a month is going to be reduced down to about $700 a month, and that's your full age retirement benefit. And it might be reduced further if you took it early. All right, now here's the kicker. Here's where people lose money who are subject to that. They keep working. They're not taking their STRS benefit. They're not taking their OPERS benefit, but they work past full retirement age. So they're not drawing their pension, and they're not even eligible to draw their pension, but they're full retirement age. They can take their Social Security at a higher rate, no windfall offset, until they start their pension. Important to note that. People miss that a lot. Now, as soon as they take their pension, their Social Security is offset $500, roughly, a maximum offset. Now, if you work part-time and you got into the system there and you only work for like 12 years or so, and you're vested and your benefit's going to be $300 a month from the state teachers, then your Social Security is only going to get offset half of that, about $150. All right, so it does depend on the amount of the pension you're drawing from the non-covered entity, state, city, county. The way you get out of having get hit with the windfall is if you have 21 or more years of coverage, YOC. It will reduce the WEP offset. If you have 30 years of coverage, it eliminates the offset. Now, this year, a year of coverage is about $26,000. Last year, it was 25. The year before, 24. So if you have, going back in history, I mean, like in 1973, a year of coverage was like $3,000. All right. So if you have 30 of those years of coverage, then the windfall will not apply to you. Because some people draw a pension, but then I had a guy who ran races. I mean, he ran events like the Pig Marathon and other marathons, and he had plenty of years of coverage, and he didn't get offset with the windfall. It's important that this does not apply until the pension starts or the funds are available. The funds usually aren't available to you. You're vested. You've been there 20 years. The funds aren't available to you until you leave. And that's when the offset would start if you take your Social Security. And in my opinion, if you're going to get offset, take your Social Security and your pension, because the pension is going to be higher, and take the offset and take the money and run. Fourth bullet, though, you can't rely on your Social Security statement because there's no web calculation in there. Okay. Government pension offset. Another offset, the windfall applies to your own retirement benefit, the windfall elimination provision to your retirement. The government pension offset affects spousal and widower benefits if you're eligible for a government pension based on non-covered employment. The spousal widow benefit is reduced by 2/3 of the government pension. So let's say we go back to that spousal computation screen, and for sake of she can get $700 a month, but she is drawing a non-covered pension from like the state of Ohio of $2,000 a month. Well, 2/3 of that 2,000 is going to offset that 700 altogether. Gets hit with a double whammy. She, on her own records, she would get windfall offset, and as a spouse, she would get offset by 2/3 of her pension. Again, it does not apply until the pension starts or the funds are available. One good thing is that foreign pensions do not cause an offset. These would be people, I have several clients who were green carded, came in the country and worked, and then going back to like the Netherlands, and they can draw a Netherlands pension, or back to Germany and draw a German pension. That does not apply to the government pension offset. Any questions, Jeff?
Can you hear me? I don't have any questions at the moment. Oh, one did come up. One just popped up. If you want to begin drawing Social Security in January of the year you reach your full retirement age, what month should you apply?
September 1st of the year before you can apply. The earlier and more often you file, the better off you are.
Perfect.
I'm going to talk about Social Security and logistics and their horrible state of affairs right now, but I'm going to save that till the end.
New question. Does a foreign pension cause WEP?
Yes. Yep. Sure does.
All right, we're caught up.
Okay, survivor benefits. Somebody died, okay? And I'm covering survivor benefits through the whole gamut, which means father gets killed in a car accident at age 28. What about his wife and children? Or a widower who are turning 60, which is the first survivor benefit. A widow or widower is first eligible at age 60 to file for a widow benefit or widower benefit. The widow or widower age 50 to 60 and disabled can file on the deceased record. A divorced widow or widower who's been married for 10 years can file for divorced widow benefits. Let me stop here for a second. This is really important to understand about divorced widower benefits. And I hear this all the time, and I'm going to literally tell you what people say to me. We sit down and do an analysis. I did one last week with a woman who's going to draw money on her own record. She was divorced, and the spousal benefit is not payable on his record. He's still alive, okay? And her ex is alive, but he's the maximum spousal benefit is going to be about $1,750 a month, okay, at full retirement age. Her benefit was like $2,500 a month. So she's not going to get any spousal benefit at all if she files now. And she's 66, okay? And she can't get that spousal benefit because she's getting $2,500 on her own. However, what I make clear to these people is you got to be alert. Find out when he dies, all right? Because now you might draw the difference on his record between your $2,500 and if he was a high wage earner, $3,600. There's $1,100 there for you. So number 3, divorced widow or widower, married for 10 years. On your own record, you're going to draw money, but you can't get a spousal benefit now. But the widow benefit, if something happens to him or her, is available. And, you know, if you've got links and you can connect and know when your spouse dies, you would want to do something then. Your ex-spouse, I mean. Mothers and fathers of any age, fourth category. Mothers and fathers of any age caring for a child 16 or younger. So, again, the father, 28 years old, killed in a car accident. Well, he's been working for 8 years under Social Security. He can't have, you know, he doesn't have 40 quarters of coverage. He doesn't need 40 quarters of coverage. All right. They compact the quarters of coverage requirement. Okay, and he would be eligible. I mean, his family will be eligible. So the wife and the 2 or 3 children under age 16 are all going to draw a benefit on his record. Children benefits, as far as survivors goes, same as it was with the spousal, through age 18 or 19 if in school, or if disabled prior to age 22. Now the benefit for number 4 and 5 is 75% of the worker's full retirement age benefit, subject to a family maximum. In many of these situations, as I outlined in number 4, you have a mother and 2 or 3 children. They're going to draw the family maximum. The other benefits, the widow, number 1 and 2 and 3, these are aged benefits when they're reaching age 60 to 62, 63. They can file on the deceased record. For all these people here, keep in mind, number 7, the earnings limits apply. All right. They always apply to those who are not of their full retirement age. Here's an important strategy. People leave a lot of money on the table. And I will put it this way. They can hurt themselves, okay, financially. I mean, this strategy, you start one benefit at a lower rate, switch to the higher benefit later at full retirement age or 70. These options apply to divorced widow or widower. This is often overlooked by the survivor. I had a number of cases in the past 6 months where the husband died. All right. And the financial planning firm comes to me and says, and the woman in this case, it was last week, the woman in this case was born in 1965 and lost her husband about a year ago. And the financial planners I'm working with, they're good guys, they're sharp, and they said, hey, we know there's a strategy here, and there was. And I did the analysis, and the strategy said, no matter what you do, you file on the widow benefit when you can get it, and then keep taking that till age 70, because your benefit's going to be $300 higher at 70. Take the widow benefit first, draw on your own benefit. If your benefit's low as the widow or widower, let's say it's just $1,500 a month, okay, you might want to file on that and take the $1,500, and then at your full retirement age, file for the widow benefit that might be $2,500 a month. So there's multiple strategies here people need to be aware of. Jeff, do we have any questions before I get into disability? Okay, I'm going to go on with Social Security disability. We are into another world here. We've left the survivor and retirement benefits and children's and divorced spouses. We're into disability benefits here. But keep in mind, okay, that if you're drawing a disability benefit, all those same people can be eligible on your record if they're a certain age or if they're taking care of children under age 16. So you may be 52 years old and disabled, and you've got a wife and 3 children. The 3 children are 6, 10, and 8, or whatever. They all can be eligible on your record here as you draw a disability benefit. Couple qualifications for disability, and these are in simplistic terms, okay? You must be insured. You need enough quarters of coverage, and it's different for Social Security disability. You've got to have 5 years of Social Security work out of the previous 10 years. It's referred to as the 20-40 rule. You need 20 quarters of coverage out of the previous 40, beginning with the month you become disabled. And you've got to be fully insured too, which is usually 40 quarters. So we have somebody who stopped working at age, 51 under covered employment, went and worked for the state for 10 years, and now they're coming back filing for disability. Well, they've got no coverage in the last 10 years under Social Security, so they can't get Social Security disability. They might be able to file for Social Security and get Medicare if their pension program, STRS or whatever, they all pay into Medicare. So they can file and get Medicare, but they cannot file and get a benefit because the last 10 years before they become disabled, there's no Social Security payments going into the Social Security system except for Medicare. If you're under 31, there's a special insured status that applies. Just keep that in mind. It's you got to have like 6 out of the last 12. Somebody's 22 years old, they can't have 40 quarters. They can't have 10 years of work. So they apply a special insured status. They need 6 quarters out of the past 12 quarters. 6 months out of the past 6 months out of the past 12. You got to meet the definition of disability, which is going to be on the next slide. There's a waiting period for payments, 5-month waiting period until checks start from your onset month of your disability. So if there's a car accident in January and you're disabled, your waiting period is February, March, April, May, and June. Your first check would be for July, payable in August. Your Medicare is effective 24 months later after your first check. So if you became disabled January of 23, then July of 25, your Medicare would come into play. If you get denied, there's levels of appeal. Reconsideration goes back to your state for another decision, because the state makes the medical decision. Social Security doesn't make it. Every state in the union has what's called a disability determination services, and they make the medical decision. The hearing goes to administrative law judge. Now, it used to be you file for reconsideration, usually takes 2 or 3 months. You get a decision. If you get denied for reconsideration, you go for a hearing. Used to be hearings took 1.5 years to 2 years before the hearing. Now they're getting it done in 4 to 6 months. They've stepped up the process, opened up virtual hearings, and it's working pretty well. Appeals counsel, if the hearing denies you, is in Washington, D.C., and that's going to be years. Or you can go to civil suit, sue Social Security for the money. But back to the hearing. You always want to appeal this to the hearing level if you get denied, bar none. Bar none, because at the hearing level, half the cases plus get approved at the hearing level. Note to self, that's disability. Here's the definition of disability. The literal definition is the inability to engage in any substantial gainful activity, which is $14.70 a month now, by reason of any medically determinable physical or mental impairments which can be expected to result in death or which has lasted or can be expected to last for a continuous period of not less than 12 months. Here's the problem. We get into that subjective area of, is this going to last for 12 months? Somebody comes down with ALS, they're automatically improved. All right. Most all terminal cancer type situations, although they're getting very, very good with taking care of people with chemo and whatever. But if you have a specific issue, medical condition that's expected to end in death, you'll get approved, bingo. And there are a list of about 250, 300 compassionate allowances. And if you're one of those, like an ALS case, or determine that it's going to end in death, they process these a lot quicker. It used to be they processed them in 6 months. Now they're doing it in about 30 days. The normal disability process, it takes about 5 to 6 months. But these compassion allowance cases, they put on a fast track, and they usually get these done in less than 30 days. I had one back in about 2012. He was in my office on a Monday, had ALS. We filed, sent it to Social Security. He hadn't worked in 1.5 years because of the ALS. So it went to Columbus the next day, Ohio. That's who makes the disability determination. Wednesday, Columbus pulled the case, gave it to a rep who called his doctor, got the diagnosis code, and on Thursday they approved the case, and on Friday he had $11,000 in the bank. So they do move on these pretty quick. Otherwise, you're into some subjective areas with back issues or heart conditions. Is it limiting, and how long is it going to last? They look at your age, your education, the type of work you did is very important. You did sedentary work and you're claiming a back problem, good luck. If you were on construction, that's another. They don't, and then your age contributes, because they're not going to send a 58-year-old to Voc Rehab who's been doing construction work for the past 40 years to see if he can do a desk job. But if you're younger, they will. So age has something to do with the determination. Real quick, Medicare enrollment periods. Medicare, I'm sure you're all aware, we're talking to a lot of agents. So the enrollment period, IEP initial, is a 7-month window that crosses at 3 months before to 3 months after age 65. A myth, you got to file at 65 or you're going to get penalized. I hear that a lot, and that's not true. I would think everybody here knows that, but there is a special enrollment period for people who continue to work, were in a creditable health care program, and there are at least 20 or more employees of the company. You get a special enrollment period. You don't have to take Medicare. and it's an 8-month window after you're leaving the credible group health plan and you're not in an IEP, initial enrollment period. The general enrollment period, January 1st to March 31st of each year. You can file in January, you can file in February, you can file in March. It used to be that if you filed in this period of time, your Medicare was effective July the 1st. That's changed this year. Your Medicare is, if you file in January, it's going to be effective in February. It's effective the next month. You don't have to wait till July. Those are the 2023 entitlement changes to Medicare. And the
Danny,
same
can
way.
I jump in real quick?
Yeah, go
We
ahead.
might be having some technical difficulties. Is anybody, I know it's really hard. Is anybody having technical difficulties? And let me just pull up my my camera real quick. Is anybody having trouble hearing? Is anybody having trouble hearing? So just let me know. If you're able to hear, just let me know. Send something in the question box. Hopefully this resolves itself. Send me a note if you're out there and things are okay. Okay, so I'm hoping this can be resolved. The majority of folks are saying they can hear well. So just rest assured that if you're having any issues, we will send a full copy of this presentation to you later, and it'll also be on our resource page. Great. Okay, we're off and rolling. Thanks, Danny.
Okay. Is your picture still up there, Jeff? Should I minimize it? All right. Okay, these are the Medicare enrollment periods. Medicare premiums. What's it going to cost? I'm sure most of you are aware of this. And on update 2023, there is the, on the back of update is the Medicare charges, deductibles, et cetera, for 2023. Part A, there's no monthly premium because you paid into Social Security through your job for Part A. And Part A covers essentially room and board if you're in a hospital overnight. Part A can be purchased. But Part B is $164.90 is the 2023 basic premium. I always refer my clients, if you want to do Medicare Part D prescription, I make sure that they see a licensed agent. I've sent along, one of the handouts was the IRMA, income related monthly adjusted amounts for Part B and D premiums. Just for your reference. And as a reminder, they're charging 2021 adjusted gross income determines your 2023 premium for Medicare. The one caution I give everyone, if you have questions on this, you can call me later, but I'm not the expert here. I just know how the system works, how Social Security works with this. You all out there, if you're in healthcare, you're the experts. You're who I would think these people would seek a licensed agent. One caution I give is if filing a tax return married but separate. I give this caution to all my clients when we talk. If you file married in a separate tax return, as you can see for Part B, the threshold goes from $164.90 a month to, if you go over that $97,000, either one goes over that, your premium is going to be $527. So I know I'm not much in the financial world, but I do know that accountants sometimes give advice to individuals. I can save you some state taxes, married filing separately. Well, word to the wise, be careful. It could cost you more than what you think. They said, you've heard people say, well, they said, and they who are they? Okay. My own word to the wise here, watch who you're listening to. They are coworkers, relatives, friends even human resources. I've had some human resources give out confusing, incorrect information. Don't assume what they said applies to you. There are classic they said statements. Well, my wife can get half of mine. Well, yeah, maybe. Or I got to file for Part A. Well, yeah, you do, but then you can't contribute to a health savings account, or you can't take it for a tax deduction anyway. So be careful there. But some classic, one big classic one I had was a lady was 69 and a half and was referred to me by a well-known company in Cincinnati. And we sat down. She put on her sheet that she fills out. I get basic information. She put on there, divorced. So we got to talking, and I called her up and I said, so you're 69 and a half. She's still working, making about 120,000 a year. And she said, I'm divorced. He died 4 years ago. I went, oh boy. Well, she talked to coworkers about filing on his record, but they told her she was making too much money. She was full retirement age. She could take it. She had left. Well, she could have got $3,000 a month for 4 years on his record. We went back 6 months, so she got 1 year of that back, about $36,000. And then she's waiting until 70 because she could have gotten 3,000 on his record from age 66 through age 70, and then switched to her own record for like 3,400. They told her wrong, okay? So don't assume what people are telling you. Consult an expert or call Social Security because of the next slide I'm going to put up. Call Social Security, and you're going to hear this again. Keep copious notes of who you talk to, when you talk to them, what they told you. And I'll tell you why. Because misinformation from an official source can happen. This is information provided by Social Security that was not correct and deters someone from filing for benefits. The example is one of the friends of ours she was 66, her husband's already 66. They called me, they had read in a magazine where she can get half of his and wait till 70. I said, yeah, you can. So she goes into a local office, goes up to the window. The window is not a claims representative. The window is a service representative. They work hard, but they're not as skilled and don't have as much knowledge. And at the window, the individual told her, oh, your benefit's much higher. You can't get any spousal benefits. She walked away. Never called me up, but about 6 months later, I decided to call up. I said, how'd that go? She said, oh, Denny, you were wrong. I can't get that. I went, no, I'm not wrong. We went back and filed a misinformation complaint, and she got back paid $19,000. Okay, it's a spousal benefit. She was due half of his. Going back to right around to at least a year. All right, so you can get information from Social Security that's wrong. Take copious notes, get yourself a Social Security journal, keep copies, date, subject, instructions, employee's name. They'll give you their first name. Misinformation cases happen a lot with Social Security. Okay, near the end, we're into a practical situation dealing with Social Security. Okay, in my opinion, and this is just my opinion, calling the national number, which is right on the screen, which is available 7 a.m. to 7 p.m. You can call them and make appointments. Other than that, you're taking a risk, because what they serve as they serve essentially as a conduit. Any situation, anything, they might send a form to you to fill out, and they'll send a note to the local office, which never gets to anybody because they're so understaffed. If you're calling the 800 number to make an appointment, they'll make an appointment with your local office. And they're open from 7 a.m. to 7 p.m. And understand that the East Coast comes up first onto the West Coast. So if you call at 7 a.m., you're only getting maybe a third of the nation answering the call. So the best time to call is right around noon to 1 o'clock, because now the entire United States teleservice system is open. And there's centers throughout the country. You don't want to call on a Monday or a day after a holidays. All right. And you still might get delayed. And if you make an appointment, try to, and they tell you, we don't have any, we'll send you an email. The email never comes. So you need to keep calling back if you want to make an appointment, or file online, which is the best way to do it. Unfortunately, you can't file widow benefits online, so you've got to make an appointment. But the local office hours where you live is from 9 a.m. to 4 p.m. Filing online versus local office appointments. Well, if you're filing for widower benefits, you've got to make an appointment. There's no online application. But the online system is the slickest, quickest, safest, bestest way to file, okay, in my opinion. I do a number of applications for my clients, and those that are there, it's a convenience item. You can do it yourself, but I do a number of applications for my clients. It works a little different, but you get the same results in about 30 days. Overpayments, just a note, if you're ever overpaid by Social Security, offer an 80% compromise offer and they'll take it hands down. If they don't, you need to call me or ask for a supervisor, because they will take an 80%. So if you're ever overpaid $1,000, you offer them 800, they'll take it hands down. For those of you that don't have a My Social Security account, and I'm talking to everybody, including anybody under age 30 that might be listening, you need to open up a My Social Security account. Everybody needs one, and check it annually to make sure that your wages are posted from the previous year or two, okay? You need to do this because I like to say, every once in a while I'll run into somebody, I'll go, what's your Social Security record shows no earnings in 2015 and 16. What happened? They go, I don't know. So you want to check it every year. And this journal is really important to protect yourself. I can coach you, but I can't play the game for you. But I can tell you this much. If you get an answer you don't think is right, ask for a supervisor. If they balk at the supervisor and say there's none available, say, then I want to talk to the manager. Everybody's got a boss, folks. Yeah, I want to talk to the manager. If the manager, you leave a message and they don't respond, I'd leave another message and say, I'm going to tell them you're going to contact the area director's office, the area director's office, if you don't respond to me. They don't like the area director's office getting in their stuff, okay? The area director's office in Ohio is in Columbus. Every state has one or two area director's offices, and they are the boss of the Social Security office manager, all right? There's also a contact that's really important that will help you, media contacts, and they're called public affairs officers. You go on Social Security's website, go into the search engine and put media contacts, and you will be led to the media contact in your area. In Cincinnati here, it's Kelly Dragoo, D-R-A-G-O-O, great lady. She's a public affairs officer. She deals with situations like this and can get them resolved. So there are issues, people come, well, what they told me this. I said, you need, be nice, be firm, but don't take no for an answer. All right, I think I've reached the end, Jeff, and if you got any more questions,
yeah,
I'm available.
Thanks so much, Tony.
One thing I want to say is I'm putting up on the screen my fees.
Okay.
An analysis for an individual and couples are shown there, $325 individuals, $595 for couples. You have a handout there that is in the that was sent on what's involved with a Social Security analysis. Now, there's a lot of bullets to it. And now not every one of those are involved on every analysis, but they can be. Many of them are, okay?
What handout is it labeled? Is it the webinar RA explanation?
Yeah, yep.
Okay.
Webinar RA.
Yeah.
So
Okay.
these are my fees, and you can go to my website, and if you have specific questions, feel free to call me. There's my number again.
Fantastic.
Okay,
Yeah,
Jeff.
yeah, we got some more questions, and by all means, fire away if you think of anything. But just want to go through these, and we're getting a clarification on an earlier question. This having to do with the widower lower benefit thing. So Danny explained a widower. Oh, forget me. Danny explained a widower should file for the lower benefit first, and then the higher one at 70 or at full retirement age. Does Social Security Administration reps provide both benefit amounts to the applicant so they can make an informed decision?
Yes, they will. But to get the widow, you've got your own information you can get online through your My account. So you can
Right.
see that.
Yeah.
To get the widow benefit information, if they need to know, they will need to see a death certificate and a marriage certificate. And if you're divorced, a divorce certificate. You can present this to them by going into the office. That's the way to do it.
Mhm.
And they will give you widower information.
Okay. Next question. Could you please discuss a bit about how Social Security does auto enrollment versus when the retiree needs to actively enroll?
Well, you're talking about auto enrollment in Medicare, I assume.
I think so. Yeah.
Yeah, if you are receiving a Social Security benefit
Mhm.
and reach age 65, you will automatically be enrolled in Part A. Okay. Now, if you're automatically enrolled in Part A and don't want it, you can get out of it. Contact Social Security and say, I don't want Part A. But if you filed and taken Part A and you got Part B and then you don't want it, then you can't get out of Part A. You can stop Part B. So the auto enrollment involves, and I tell people this, that, okay, you're going to file for Social Security at 66, but keep working and you're under a group health plan. They're going to send you a Part A and B Medicare card. And you need to refuse Part B if you want to. I mean, you can take Medicare and get off the group plan.
Yeah.
But your auto enrollment in Medicare can be refused. And if you're automatically enrolled into Part A, you can refuse that too. You may have to jump through some hoops and contact Social Security. But if you actually took Part A yourself and have Part B, and along comes, oh, I got another job in a group health plan, I don't need this. You can get out of Part B, but you've got Part A for forever. And that determines what you can, whether your contributions to a HSA are deductible or not.
Good point. Next question. Do you happen to know when the statute of limitations on Social Security misinformation cases, I guess, expires? I have one that's 50 years old.
How old?
There's a Social Security misinformation case that is 50 years old.
Mm-hmm.
Wow. When's the statute up?
I think it's a 10-year statute.
Okay.
But if that person would call me up, I'll research it further. I just can't do it right now.
All right. Numbers right there on the screen, guys. Why can't you waive Part A after you have already enrolled in it? It's a great question.
Why can't you what?
Waive Part A after you've already enrolled.
If you enrolled, you said you wanted it, okay?
Yeah.
You enrolled. I want
Can't
Part
suspend
A.
it. You just can't
And you're
suspend
stuck
it.
with it.
Yeah.
If you're automatically enrolled because you're getting benefits, you can get out of it.
Yeah. Why would a person not ever want Medicare Part A?
I'm sorry, what, Jeff? Why would they what?
Why would a person not ever want Medicare Part A?
Because they're on a group health plan covered.
Mhm. And
Okay.
because they wouldn't be able to
But-
contribute to an HSA.
Yeah, I mean,
Yeah.
contribute to an HSA is not an issue. Taking the tax deduction is. You wouldn't want Part A if you're on a group health plan.
Yeah.
Or at least you need to know that your contributions to that are not tax deductible anymore.
Okay.
But you wouldn't want it because of the HSA situation.
Yeah. Okay. So need some clarification here. I'm confused on the spousal Social Security benefit. If both husband and wife have worked and are the same age, if husband, the higher wage earner, takes the benefit at full retirement age, then spousal can take a spousal benefit and wait until age 70? Question mark. That's a question.
Not if they're born after 1953.
Okay.
Well, let me put it this way. Not since 2016. When he files and the spouse files, she's got to take her own benefit first. That was a change in the law. You used to be able to do that. Okay. But not anymore. If you're both the same age at full retirement age and you both file, she's going to take her benefit first, and then any spousal due would be paid. She cannot, essentially, she can't restrict. All right. Or he can't restrict.
Okay. Got to
Your
take
spouse.
your own. Okay. Hopefully that clarified that. Yeah, and just to, she's talking about HSA deductible. HSA deductible contributions, maybe she can clarify on that. HSA deductible contributions.
Well, they're deductible if you don't have Part A.
Right.
I believe, I could be wrong, and there's agents out there who can correct me, but
yeah,
what I've heard from agents is you can still contribute to the HSA, but you can't take it as a tax deduction, which is the reason for contributing to the HSA. So it'd still be there to pay any,
right.
Of your deductible.
Thanks, Steve. We got a confirmation that's true. And next question, my husband is collecting Social Security benefits. I'm 65 on Medicare, but I'm waiting until full retirement age to collect my Social Security benefits. Can I collect Social Security benefits under my husband now?
No, if you're both age 65, when you file, you've got to take yours first. And then if anything is due as a spouse, they would pay you. So you would have to have a low benefit it would have to be less than half of his. But when you file, you've got to take your benefit first and then any spousal that's due. You don't have a choice. That goes for every situation like this now. That was changed back in 2016.
2016. Wow.
Unless you were born in 1953 or earlier.
Yeah. Okay.
Then you can do it. Most of those people have already filed.
Okay. Keep them coming, guys. Here's another one. If you have Part A and you're on group health and the employer is contributing to the HSA, does that contribution become taxable to the employee?
Right. The employer's contribution?
Yeah.
That shouldn't be taxable to the employee. I wouldn't think. I mean, that's an IRS question.
Yeah. If anybody can add on to that, please. But the employer is contributing to the HSA and the guy's got Part A. Is it tax deductible?
The employer can keep contributing.
Taxable. Couple more questions, and we got a few minutes, but the next question, Part A, in addition to a group health plan. Okay, so here's the question. Here's the comment. Part A pays in addition to a group health plan. and not charged nor taxed for it. Okay. One more question. If you wait beyond 65 to file for Medicare due to EGHP, and I'm not sure what that means. EGHP, maybe that means Employer Group Health Plan.
Yeah.
And then filing using an SEP,
Yeah.
is there any circumstance where the SSA does not backdate Part A by 6 months?
I don't think so.
Okay.
I think they're going to backdate it to 65 or back six months.
Okay. All right. I've got a personal question. I've run into this a few times, and maybe you can chime in on this. Folks bringing their parents over from overseas, you see this a lot nowadays. These folks are over 65. Actually, they haven't been paying into our system. And so they need health insurance. Can a over 65 green card client, can they buy Part A and Part B?
I'll put it this way. I think so.
Okay.
I think so. I don't think they're limited. I don't think you have to be a citizen to buy into Part A. I'd have to check on that.
Yeah.
And if I'll get this is your question, right?
That's my question. I know there's provision for them to get the ACA coverage, but in some cases it's not, to their benefit. Maybe there's too much income and the ACA is expensive.
Yeah, I don't want to say yes or no. Let me research that and get back to you.
Yeah. Okay. Guys, fantastic. Thanks so much for your input. Denny, take a bow. Terrific job. Everybody's really happy with the knowledge and the insights he provided today. I want to tell everybody this will be sent out to you. This recording will be sent out to you. But by all means, when you get a chance, print off those handouts so you have those at your discretion. And Denny, do you have any final thoughts before we wrap up?
No, just be careful when dealing with Social Security. I'm getting a lot of. One final thought. Okay, COVID killed them. Okay, as far as education goes, we all worked in offices where there's the new employee and there's the experienced employee. And at Social Security, it was the same. And the new employee learns from the experienced employee. And during COVID, the new employee and the experienced employee were not together. So the new employee would shoot from the hip bad information when they took a call because there's nobody around them to ask a question to. And that started a avalanche of misinformation. So just be sure when you're talking to people, you're getting their name and protect yourself, I guess, is my biggest thing I'm seeing right now. But I thank you all, and I thank you, Jeff. It's been a pleasure being here.
You betcha. Everybody have a great day. We'll talk soon.
Okay. Thanks, Jeff.
You bet.